can't ever forget the climax of the famous movie Coma, where this young medical intern who was wheeled towards the surgery for an emergency operation, and she desperately clutched to her boyfriend, frantically trying to stop the operation because she knew about a corrupt racket in the hospital on the top administration of selling organs from comatose patients. Now, this book is written by none other than the famous Robin Cook, ophthalmologist by profession. He has written similar many books about the corruption and the murkier side of the medical world. Are these just imaginations or gibberish, or there is some truth in it? Actually, a Dutch pathologist who worked in Canada and England was charged with selling organs from dead children. Now, when he was caught red handed, he had pleaded not guilty, saying that he obtained the permissions from the parents. Human dead bodies are a great teacher. Now, there is no alternatives for studying the real human beings, the real human anatomy in dead bodies. The legacy which Mr. Gray, who has written Gray's Anatomy, started by studying and documenting human anatomy in dead bodies is still continuing. As a medical student, I had to dissect those dead bodies. Now, these dead bodies, getting these dead bodies is becoming a rarer and a rarer. So, those bodies which are unclaimed, those can be taken to the medical college, and we usually studied our anatomy, did the dissections on these dead bodies, on these unclaimed bodies who have been abandoned by their relatives. Now, it's a huge shock for a teenager, a first year student of medical student, to go through these stinking, rigid, morphosed dead bodies and to study anatomy. These are something was totally different from real living human beings. Now, I'll tell you a very interesting story here that because the dead bodies were getting scarcer and there was a demand of these dead bodies for the medical colleges in England one time, there were two people who committed murders and supplied these dead bodies to the medical school. Now, they used to attract people, asking them to come for a free drink. And after giving them a lot of drink, they got drunk. And this person, Bark, with his associate, used to sit on the top of that drunk human being. And the other person used to drag the person in the floor, and ultimately this person died of asphyxia or hypoxia, lack of oxygen, and then this body was supplied to the medical colleges. This method of killing is also become famous in the forensic medicine as Bark's method. They were finally caught, fortunately. Rabindranath Tagore, the famous writer, philosopher, and a great stalwart of Bengali intellectuals, had a very scientific-minded home teacher, who had once bought a voice box from one of the medical colleges and tried to explain to the young child, Rabindranath Tagore, how a human being speaks. Rabindranath Tagore went to a severe depression on that day and had later on written in his autobiography, Jivan Shriti, that I always thought that human beings talk as a whole, not like part by part. I cannot accept a human being as a part by part structure which is doing different functions. As I said, dissecting a rigid cadaver, dead, in the dissection halls of anatomy schools and colleges is pretty depressing. It removes the vestiges of all the romanticism from a young mind. As I was saying also that in 1820s, when this bark and hair killed these people for supplying the dead bodies to the medical colleges, it was a shock to the entire world. But the shock is much less when this is a crime committed outside the confines of the medical world. But when the corruption is deep inside the medical world itself, then it's really, really depressing and shocking. Transplantation technology has gone to a new level. There is huge demand of organs now. Even hearts and liver are being transplanted regularly. But there is scarcity of these organs. Despite people appealing throughout the world, these organs are not easy to come. So there would be some illegal means trying to procure this precious golden organs. Not only for this to save one's life, the study and researches on organs, human organs, is very, very important. Now, for hundreds of years, millions of guinea pigs, rats, and monkeys, etc., have been slaughtered to do research on their organs, despite the vehement objection from the animal rights group. These species were sacrificed to improve the life and lifespan of another particular species, that is the human being. But at one stage, human organs are necessary. It cannot be just animal organs which can help us in the knowledge. Now, in certain states of United States, it is mandatory to mention what organs the driver would like to benefit in case of an accidental death. It's quite an astonishing concept. This is done because if the organ cannot be taken out immediately from the dead body, there may be irreversible damage to it and it can become useless. An American journalist in a BBC interview had said that he won't mind donating an organ of his relative if this is for the welfare of humankind. But if it is acquired in an illegal means, it would be a criminal act. So, as days will go on, we would need researches on these organs and donations would be necessary. For certain, otherwise it would be totally illegal. But for certain scientists, they don't care. For them, their own ego and to publish a excellent or a shocking article, or I would say a transforming article, transforming the scientific boundaries, would be much more important. They will see human beings as a collection of certain organic tissue, which is a very good material for research. This reminds me of a very interesting case. In England, one of the GPs noticed that there was unusual deaths under of certain patients under a particular GP, her colleague. She went on to this investigation and found out that many elderly individuals under the care of Dr. Shaw, that particular GP, had died quite suspiciously. Now, this caused huge uproar in England. This Mr. Shaw or Dr. Shaw became one of the most heinous or most I would say in that notorious serial killer. He used to kill many of his patients who entrusted him with their lives. They believed in him with their own lives, and yet he took his lives. He had pleaded not guilty, or probably he was doing some kind of a mercy killing. Now, it needs some different kind of courage or some extra courage to treat a patient, to inflict pain in the form of surgery, for example, to cure a patient. If something goes wrong, it would be devastating for both the patients. I remember a surgeon who used to tell me that only one thing he prayed every day, that he would lie in the bed and go to sleep every night peacefully. For that, he needed a clean conscience, which sometimes is so difficult for a medical person. Often, a deep psychological bond develops between a doctor and a patient. Yet, when the doctor needs to treat this patient, he needs some kind of a detachment. If it's too much emotionally involved with the patient, his treatment can't be proper. It may falter. So this kind of emotional detachment is very important. I know doctors who becomes upset seeing a road traffic accident, and yet if this victim is taken to the operation theater in front of him, he won't feel anything and he would go successfully on operating on the victim. When the surgeons operate, they often forget about the entire human being and they concentrate on that rectangular exposed area where they are doing the operation, concentrating on the blood vessels and tissues of particular that area. This kind of detachment, this kind of professionalism is really important for good treatment. But on the other hand, this kind of psychological detachment can be very stressful, and some people can get burnt out and they may leave this profession, and others can become overconfident and they may start thinking themselves as gods or demigods. But they are nothing, metaphorically, they are nothing but competent service mechanics of a grand design, the human body of Mother Nature or God, whichever you want to believe in. Now, I was talking about the Mr. Shaw's case of serial killing of patients under him, who depended so much on him, everything upon him. Probably he was doing some kind of a mercy killing, that these elderly patients, they were really moribund. So why not remove their sufferings, take them off forever? But the mercy killing should be under strict guidelines. If somebody does it unilaterally, taking the whole responsibility himself, it is nothing but committing murder, completely illegal and a heinous crime. Recently, England and Wales have passed laws that assisted killing is now legal there for somebody who's suffering from intractable disease which cannot be cured and which are painful. So that's one of the advancements, but that should be done under strict legal guidelines, under proper supervision. Now, in this medical world, most of them are Dr. Jekylls. They are doing the best for the mankind, but there are and there would be some Mr. Hydes, and that is we have to prevent, or we have to remain vigilant of. And because if you are entrusted with the responsibility of looking after a human body, you must be very integral, honest, and compassionate in your mind. Otherwise, there's always this provocation of crime taking you down the darkest slope. If you like my videos, please like it, and I would be delighted if you subscribe my channel.